Welcome to another Psych review video. In today's video, we're going to cover everything you need to know about Generalized Anxiety Disorder GAD. We're going to cover presentation, signs and symptoms, diagnosis and treatment, and everything you may encounter during your exam. So let's begin, as always, with a test question. So a 50-year-old woman with Generalized Anxiety Disorder has worsening fatigue, palpitations, and weight loss. She reports increased anxiety. What should be evaluated first? Increase SSRI dose, evaluate thyroid function, add benzos, or order brain MRI. As always, if you don't answer, don't worry about it. By the end of this video, you will. So let's start by going over the description of generalized anxiety disorder, which is characterized by excessive. That is the key word in presentation. These patients are going to have excessive, uncontrollable worry about various everyday events or activities. These people just worry a lot. And the key is it's lasting for at least 6 months. This chronic anxiety is disproportionate to actual situation and causes significant distress or impairment to these patients. Patients often experience physical symptoms as well, such as restlessness, fatigue, muscle tension, and sleep disturbance. So, these are excessive worrying patients, and the symptoms are lasting greater than 6 months. The memory hook that I have is just general anxiety daily. It's lasting greater than 6 months. So, GAD, general anxiety daily. Exam tip, you should always consider GAD when worry is present. It is not tied to a specific trigger and it's lasting greater than 6 months. Don't confuse this disorder with panic disorder. Panic disorder is going to be episodic. It's going to have sudden, intense fear with physical symptoms. Don't confuse it with adjustment disorder, which anxiety is related to the specific stressor, resolving within 6 months. General anxiety disorder starts at 6 months. Social anxiety disorder, which is anxiety specifically triggered by social situations. This is a good time to tell you that this lecture is presented to you by PA Psych ER study book, in which we cover 57 topics from the blueprint. It also includes, as a bonus, 120 mock exam questions. We will cover every topic so you can study smarter, not harder. I wish I had something like this when I was in PA school. It would have saved me time so I can spend it with my family. So do check it out and let me know what you think. So let's continue. What are the causes of general anxiety disorder? Well, the genetic predisposition and a family history. For a neurochemical imbalance, you're looking at GABA and serotonin, and environmental stresses and trauma can play a role. So exam tip, rule out medical causes such as hypothyroidism or stimulant use before diagnosing somebody with general anxiety disorder. Don't confuse this with a substance-induced anxiety because that will have a completely different presentation. Hypothyroidism is seen in major depressive disorder. So, general anxiety disorder. Mnemonic that I have is worries. So if I think about general anxiety disorder, I think of mnemonic worries and I write it down a list. W stands up for wound up, restless, keyed up, on edge person. O in worries is on edge, fatigued. First R is restless mind, poor concentration, mind going blank. Second R is really irritable. I, irritated muscles. E, energy drained at night. And S is for 6 months. Worries. Wound up, on edge, restless, really irritable, irritated muscles, energy drained, and 6 months. Clinical presentation is going to be somebody who has excessive anxiety and worry about multiple events for greater than 6 months. They have a really hard time controlling their worries, and that's why they have difficulties with activities of daily living. So exam tip, they must have 3+ symptoms or just one greater in children alongside worry to be diagnosed with general anxiety disorder. Don't confuse this with the normal stress or occasional worry. So this one is going to be lasting greater than 6 months. Labs. So in general anxiety disorder, consider running TSH, CBC to rule out hyperthyroidism or anemia if it's indicated. Exam tip, there is no specific imaging needed to diagnose. This is based on a clinical criteria. Don't confuse this with anxiety. Could be secondary to the medical illness. And the treatment for general anxiety disorder would be the first line will be SSRI. Cognitive behavioral therapy can also be used. Buspirone can be used as adjunct or alternative, and benzodiazepines for short-term use only due to the dependency risk. Exam tip: CBT plus psychotherapy yields the best outcomes. So in exam questions, they can explain a patient with generalized anxiety disorder and ask you which of the following treatment or treatments is the one that yields the best outcomes, and you should be thinking CBT plus meds. Don't confuse it with a long-term benzodiazepine use without other therapies. And a high yield review to summarize everything up: with generalized anxiety disorder, you're going to look for somebody who has excessive worry that is lasting greater than 6 months with multiple associated symptoms. They must have 3+ symptoms, such as restlessness and muscle tension. You're going to treat them with an SSRI and CBT as a first line treatment. Benzodiazepines are only used for short term relief, and you should rule out medical and substance causes before diagnosing. So chronic non-episodic worry is hallmark of generalized anxiety disorder. Back to our question. A 50-year-old woman with a GAD had worsening fatigue, palpitations, and weight loss. Those are your three symptoms. She reports increased anxiety. What should be evaluated next? Increase SRI dose, evaluate thyroid, add benzos, or a brain MRI. And for her, we should be evaluating her thyroid function. Hyperthyroidism can mimic or worsen anxiety symptoms. Increasing SRI dose without ruling out medical causes may be ineffective. Benzodiazepines do not treat underlying cause, so that one is out. And we should not order any imaging unless we are dealing with some focal neurological signs. So that brings us to the end of this lecture. I hope you enjoyed this one. Good luck on your exam. Do check out a book because it might be a game changer for you. And as always, good luck, and I will see you in the next video.